What's up, everyone? This is Dr. Webb here, and today I'm going to be talking about a question that you would get if you're a pre-med student, if you're applying to medical school, you're going on interviews. People are going to ask you, why do you want to become a doctor? And I want to tell you guys why I became a doctor and reasons why you should pursue that path if you're considering it. In high school, I attended a medical magnet program in Louisiana that got me initially interested in medicine, and that's the reason why I'm a doctor today, because of that program. Growing up in Louisiana, I got into a lot of trouble hanging out with the wrong crowd, hanging out with the wrong people, and I found myself doing things that could have landed me in jail for a long time. But I came upon this program in Louisiana, in Shreveport, Louisiana, called the Fair Park Medical Careers Magnet Program, which we took classes in the afternoon. Medical terminology, anatomy, physiology, some healthcare classes, and I credit that program for keeping me straight, keeping me off the streets, and for me, the reason why I became a doctor. Ever since that program, I wanted to become a doctor. I joined the military at age 17, and I did 8 years in the military. I went to Iraq in 2005 as a combat medic, and along that entire process, I worked to become a doctor. And that's the reason why I'm a doctor today. It started in 2001. I started taking classes at a community college in San Antonio, Texas, and I'm still in school to this day. It's 2017, so to become a physician, it's a long process, a very long process, a very challenging process, but it's doable. It's definitely doable. You have to definitely take it one day at a time. You have to think of it as a marathon, not a race, because there are many days when I kind of doubted myself. I can't do it, man, the work is too hard. I feel like giving up, but you just have to keep your head up and keep moving forward. You're going to get beat down in med school. Med school is really challenging. Tests every week or so. You got all this information you have to learn, but I want to let you guys know that it is very doable. You have to be dedicated, and you have to sacrifice certain things in your life, such as friends and family and going out on the weekends. You have to sacrifice those things. But I mean, if you want to be an astronaut, if you want to be an NBA player, those guys, they sacrifice and they practice. Same thing in medicine. You have to put in the hours of preparation, of studying, in order to be successful. So the reason why was because of that program in high school, and I love helping patients. I hate seeing people suffer, and that's one of the reasons why I went into surgery, because I can do something for someone who comes in with a fracture and have pain from knee arthritis, and then I can do a knee replacement to completely get rid of their pain. So find out what you're passionate about, and if it's medicine, then go after it. There's really no age limit. I get a lot of questions from people, emails, asking me, are they too old for medical school? There's really no age limit. I saw a nurse who applied to medical school five times and took the MCAT 5 times, and she finally got into medical school. The oldest person in my class, I believe, was like 46. The youngest was like maybe 22. So a wide range of different people of ages. If it's something you want to do, you're 45, 50 years old, if you were in another career before, you want to go into medicine, I say go for it. Most people in medicine will be in that particular field for 30, 40 years. I work with 3 surgeons who are 80 years old. So they've been operating longer than I've been alive. So starting off at 35, 40, I mean, you're still going to work another 20 years, 30 years. So that's a whole another career. So I say go for it. As far as medicine, there's a lot of different changes that are going to be happening, especially with the change in presidents, changes in the healthcare administration with the ACA. I think it's unpredictable how our future will be, but I think medicine gives you a stability, it gives you a good a lifestyle. You make a decent living. So I say find something that you're passionate about. If it's medicine, go for it. Just figure out look deeper down inside and ask yourself, why do I really want to do this? If it's for the money, I wouldn't necessarily do it because it's not really worth it how much hours you'll put in, how many years. But if you're passionate about it and really want to become a doctor to help others for the need of others, I say go for it. Of course, it's going to be hard. The process is very long, but it's doable. If you put in the hours, put in the work, you guys can do it. If I can do it, you guys can do it. This is Dr. Webb. This is my reason why I wanted to become a doctor, and I hope this inspires you to never give up on your dreams and goals. If you want to become a doctor, go for it. Talk to you guys later.